you can't choose not to pay your gas bill. You won't have gas, right? Like you can't choose not to pay your electric. You won't have electric, right? With medicals, certainly you have a choice in the interim not to pay, but as you mentioned, we're paying. If you have to show up in the emergency room, if you, I'm a cancer survivor. When I was going through this, I didn't necessarily have the best insurance. I mean, I spent years paying off medical debt.
Welcome back to Around the District. I'm Nicole Brown.
And I'm Gabby Mazar.
And we're here again with Dr. Raquel Rockee Armstrong. So tell me, you canvass a lot, right? You've been canvassing because your election will be in November of next year. So what do you hear? What do you hear from your constituents?
Sure. So in knocking doors, a lot of times I hear education being a top issue. People are really concerned about the future of their kids or grandkids, or nieces and nephews, but also affordability. I think people are really clued into what's happening on the national level. I think because, all that's happening with our federal government is playing out on every possible platform, social media, etc. That's where people are very, very clued in. And so I think when I'm engaging with, potential voters at doors, it's kind of trying to dissect like what role does the state have in addressing their issues. And so, education is typically a states' rights issue. That's definitely something the legislature has a lot of control over. But when we're thinking about affordability, it's really having the conversation around where is the state going to be, or can they be a stopgap for what's happening? And, areas like that are things like healthcare, things like, addressing the complexity of housing, what that looks like. And I think housing is super complex in Arizona because the needs of, say, Phoenix are very different than like the needs of my district in Chandler, and Sun Lakes, right? They're vastly different. And so getting people to agree at the state level on those things is super complex.
Well, let's talk about healthcare for a second, because at the end of this month, the Affordable Care Act, the premiums, or Obamacare, for those who don't know that they're one and the same, they're going up a lot. For
My insurance is going from $243 a month to $600 a month. And
My goodness.
I had to lower my insurance plan. So I have a lesser plan.
Yeah.
And I'm a business owner, so I'm self-employed. But yeah, I had to get a lesser plan, and I'm paying $400.
What's that percentage increase from two? It's more than double.
I mean,
that's more than double.
easy.
Yeah, way more.
I mean, I can't do math
More
off
than
the top
double.
of my head, so
150%. Yeah.
yeah, it's more than 50%.
Yeah.
150%. Yeah.
It's crazy.
Yeah.
And we're gonna see that fallout because people are gonna be opting to not
I thought about
be
it.
insured.
I thought about it. I really thought about it. I mean, I waited to the very last minute because I was like, I don't know if I can afford this. I mean, what are my options? Do you pay $600 a month and risk not having insurance? And I really weighed the options. I mean, I spent $0 to my deductible. I didn't go see a doctor last year at all. Like, why? I mean, I did not see my primary care. I didn't go see I use a naturopath because that's what works best for me. So other things I do use prescription drugs. I do use lab tests. But so those things are covered, but the cost of insurance to the cost of paying out of pocket, you have to weigh your consequences of that. And I think, we've talked about people losing insurance, and I think that we are really going to see a huge drop in people, in insured people.
Yep.
And that's going to have a ripple effect. We're talking, whether it be, the doctors, whether it be, our entire, healthcare system, whether, all these things have to work together, right? Hospitals will close, right? I mean, we're already seeing it. That's already happening. And so I think, that is going to be a huge blow. And we already know that, mental health, right, is an issue, whether it be from, the education space to other areas. But if I can't even afford my basic medical care, that is definitely not going to be top priority, right? And so, how that actually equates to what we see in our communities, even just with, the numbers of our unhoused population going up. I mean, I've been partnered with Matthews Crossing Food Bank and doing some work with them, and they were sharing about even prior to the government shutdown we experienced, that the numbers of people that they have been serving have almost doubled in 2025.
Wow.
Right. And most of them being like 6-figure earners that have lost their jobs. Right. And so when we're talking about that, along with trying to pay a healthcare premium, something's got to give. Right. And so the question becomes, where can the state, serve as a stopgap? Because they're going to have to. But our state budget is stretched at the seams as it is. Right. So what are the sacrifices that we're willing to make to ensure that Arizonans have what they need?
Right.
That's the question that's on the table.
And that's going to come up because think about it. You are one person. You only have to be responsible for just you.
Right.
But those who
have a family,
and kids, and then even if you do have a job, people think that they're not going to be impacted, but your rates are going up too.
Yes.
Like through your employer, that's going up too. So it's going to impact all of us.
What people don't consider either is that, in countries that have universal healthcare, everyone's covered. In a country like ours where people aren't covered, what people don't consider is that if someone goes into the hospital and does not have health insurance, they're not going to leave that person there to die. Correct. They treat that person. But somebody has to pay for that.
Yeah. Yep.
And the person that has to pay for that is everybody else.
Yep.
So the people that are paying for health insurance are now paying for that. So their premiums go up, which is why we have such a problem in this country. It's not that, everyone should have the right to health insurance. Everyone. Yes. We are the only, developed nation that does not have universal health care. It is absurd to think that someone does not deserve the right to be taken care of in their health. It's absurd.
And it's a myth that
it's a myth.
The reason people don't want it is because it's only helping immigrants, which is
myth.
Beyond ridiculous.
It's an absolute
myth. It's not true. Let's just say it's not true.
It's untrue. I have been in other countries where I have gotten sick or I have broken bones, and that country has taken care of me.
Yeah.
I did pay out of pocket for whatever, but I broke my foot in Turks and Caicos. I paid $250 for an ambulance, painkillers, x-ray, emergency room visit, and crutches. I had pneumonia in Belize, which is Dutch. Not Dutch, I'm sorry. But, I had pneumonia. I paid $700, which was also covered by my travel insurance. So always get travel insurance, by the way. But
disclaimer.
But, and that was covered also. So like other countries have these. And when you go to these countries, you're covered. So the idea that just because you're an immigrant or just because you're traveling to another country, you shouldn't be covered as well. Why?
Yeah.
You're a human being.
I think that is what boggles my mind the most, is that the uncaring of just basic human decency of other people, right? Like, oh, they can't, they're immigrants and they deserve whatever. We are a nation built on immigrants.
Absolutely.
Let's think about not even just healthcare, but education.
Yeah, education.
You don't have the right to education. You don't have the right to food. You don't have the right to healthcare. You don't have the right to a job. What?
Yeah, that's where we are.
A human being. Period. Let's go there.
Right.
Really?
And I'm glad you talked about the ledge, and they are going to have an ability to have some type of stopgap. We don't know what that's going to look like, but it's going to come to the table, and they're going to need to address the issue because, again, the premiums for the Affordable Care Act, they're going up at the end of this month, December.
Absolutely.
And January 1st, you're going to be paying almost triple what you paid before, which is crazy. So, mental health, though, let's talk about that just for a second, because I feel like that's going to get worse too. Because as the cost of living goes up, premiums for healthcare goes up, tariff, and if you don't believe we pay the tariffs, please get educated because we pay the tariffs. So, the rising cost of food, gas, all of that.
Everything.
So
everything but your salary.
everything by your salary.
Yeah.
That's good.
Yeah.
That is true too, because corporation CEOs are making
And well, salaries are going down, I think, you know.
and
to be
you
honest.
may lose your job if AI.
Right.
The more we get integrated with
Every
AI.
week I encounter someone who tells me that, you know, they have now been laid off or lost their job, and if I have any connections to, you know, something, and it's people who are in fields that, you know, they are in the tech field, they are in the spaces where someone said this is going to be a little bit more stable because it's growing, right? But I mean, people are vulnerable right now, even just in terms of income, while everything else is going up. And unfortunately, when you can't choose not to pay your gas bill, you won't have gas, right? Like you can't choose not to pay your electric, you won't have electric, right? With medicals, certainly you have a choice in the interim not to pay, but as you mentioned, we're paying. If you have to show up in the emergency room, if you know, I'm a cancer survivor, and I remember when I was going through this, I didn't necessarily have the best insurance. I mean, I spent years paying off medical debt, right? Someone is paying, right? And so we have to figure out, particularly with the when we're talking about mental health, nothing, you know, makes people more anxious or more, you know, perhaps finances are always a big top thing. Think about the holiday seasons, right? We see the most amount of, you know, mental health related incidences in communities during the holidays. Why? Because people are worried about gift giving and all these things where they don't have the financial means to provide, right? And so when we magnify that, right, we're going to see that show up in, you know, more people who are out of work, more people who are unhoused, more people in need of resources that we cannot provide on a holistic scale, right? It's a domino effect.
So what role should the legislation play in that?
Yeah, so I think that, you know, personally, I would love to be able to do an in-depth study on our health system and where the state is involved, because I think we have, you know, our the way that our Medicaid system, the way it's functioning in Arizona, it might not be at the forefront now because we have a lot of issues at the table, but there needs to be some work there, right? We have a shortage of doctors in Arizona. That's something that hasn't really hit the news that much. But think about, you know, for those who actually have conditions where they see regular people, it takes a long time
Is
to
that
get
because
into a
they're
doctor.
leaving, or nothing's attracting them to Arizona, or are they leaving the state?
It's around the hospital system, right? And so you typically have to, I mean, you could go into private practice, but most doctors have to be affiliated with a healthcare system. But if the systems are closing and shutting down, there's less room there. And so now the lists are long, the waits are long. It takes a long time to get in to see specialists. And as a result, right, it doesn't stop an illness. My illness isn't going to wait.
It's not going to wait.
You know what I mean? And so I think that the legislature has to take a big inventory of, you know, where they're able to intercede, where the federal level is particularly underserving our population. I don't have an immediate answer right now because I think for me, you know, I'm one of those people. I want to really look at the numbers. I want to really look at what's at play right now, and then be able to more accurately speak to what that looks like. But I do know it is going to be a major issue. And again, not just with our elderly population for sure, but with kids, right?
Yeah.
Our kids that are on access, right? That's going to impact schooling. When we were, you know, had the conversation around the increase in student discipline and all those things, well, a lot of times it's also tied to medical stuff. And if they don't have access to the doctors, they don't have access to the resources, that's going to impact and further drive our education system in the home.
Yeah, and it's really sad with students because you do see like the suicide rate in schools is going up.
Yeah.
And you know, that's something like I don't even think we have a suicide hotline anymore. Didn't the Trump administration get rid of that?
Yeah.
So, you know, that's another issue.
Yeah. So we're here with Dr. Raquel Armstrong, and we're going to come back with part 3 and come back to her again. So this is Around the Districts podcast. Please share, like, follow us on all the socials, and we will see you for the next episode.